Hello. We have two more speakers, so we'll have to divide the time because we exact 20 minutes and you want to keep 5 minutes for questions.
So I'll call upon Dr. K.V. Satyamurthy, head of our cornea refractive surgery from M.M. Joshi Institute, Karnataka. So he'll be speaking on the communication problems that we face in our refractive surgery practice. It's a very a fast-driven, commerce-based and very high aspirational surgery. So obviously, that's where you're going to really have problems. Over to Dr. Satyamurthy.
Good afternoon. Thank you, Dr. Krishna Prasad, for giving me this opportunity to be part of this program. I do agree with all the speakers that communication is very, very important because for the patient, he can get the answers only from the doctor, not his neighbor or his relatives or somebody else. So it is, patient has got every right to get his doubts cleared, and he has every right to ask the doctor as to what, because he is undergoing the treatment, or undergoing the surgery, whatever. And then communication refractive surgery is very, very important because for three reasons. One is they're all youngsters with lot of aspirations in life, and along with that there will be a lot of doubts also. So we'll have to clarify. Second thing is the present generation, they Google a lot, they ask a lot of people, they get their doubts. So all these doubts need to be clarified. Third thing is they would have paid more money for refractive surgery, and money always equates the doubts. So the chair time. Now, patients' expectations and the fears, which are quite natural actually. First thing they ask is whether my number goes completely. Second thing, whether I'll get 100% good vision after surgery, irrespective of whether patient had very good vision before surgery with the glasses or not. Once the refractive error goes, it will never return. Whether the same number will come back to me or not, these are the fears they have. And then there is no need of wearing glasses throughout my life. Once the laser is done, or once the refractive error goes, that's what they think. And then any number can be corrected with the laser. Whether it is -1 or -20, it has to be corrected with laser. And once the error is corrected, there is no need to come back for follow-up. And there is an age limit for this. So I am about 40, 45 years old, whether I can still go for surgery or not. And LASIK is only for minus numbers. These are some of the doubts they have. And then whether it's a painful procedure, it's too expensive, it has a lot of side effects, and then one can become blind following surgery, because both eyes are done simultaneously, one after the other. So all these questions can be answered only with counseling. For this, we'll have to explain the patient about this thing, the type of procedure. This comes after evaluating the patient completely and then deciding as to what can be done for this particular patient so that we can get rid of the refractive error. Now, one thing I liked from Madam's talk is this: you will have to be positive. So this is what the patient also expects. That is the body language probably that reflects in us. And then address each and every question of the patient. In my practice, actually, I don't talk much to the patient because the chair time is very, very important. And then I tell them that counselor has been trained very well. Still, if you have doubts, you come back to me. Then we'll sit and decide. And that can be done only after completing the evaluation test, evaluation of these things, to know whether you are suitable for this procedure or not. And we can tell the patient that laser correction takes only 5 minutes per eye. So 10 to 15 minutes, your surgery will be over. And then ICL is around 5 to 10 minutes, and then absolutely painless procedure. And then you can discuss with the patient about do's and don'ts also as to what he or she has to do after surgery, and then why follow-up is crucial. This is very, very important because many people think that once the refractive error goes, that means the entire disease has gone. Myopia is a disease actually. So why should he come back for follow-up? All those things we'll have to discuss with the patient. And then to expect what? Say, my vision earlier with the glasses was poor, and how can it be corrected completely and I can get back to the same vision? So what to expect? This also we'll have to discuss with the patient so that all these things have to happen prior to surgery. Whatever we speak after surgery doesn't hold good at all. Why the patient has to come back for follow-up? We can show him the photographs, and I have only corrected the refractive error probably. So you'll have to come back for these reasons. There can be thinning in the area. It's just like a old cloth stretching, and then you can develop breaks. That can happen anytime in your lifetime. So, and then it may be, the vision may be good, very good now, but later on you are likely to develop the complications of the disease as such, the myopia. There can be a myopic degeneration in the center, or this is one, I'll just give one example. One-eyed patient after phakic implantation got 100% vision, 6/6. Patient was happy for 2 years. Suddenly she came back rushing, saying that my vision has dropped since yesterday. Then when I saw there was a subfoveal blood clot, that was because of myopic CNVM, which also we'll have to discuss, maybe in a subtle way prior to surgery, that this is what can happen to you. And then the post-op counseling is very, very important, because many patients, the counselor, or even we for that matter, we also tell the patient, we'll tell him that, wow, everything goes off well, and your vision will be very good. So promise him sun, moon, everything, and that is possible, but it is not so. One thing is because of dryness, which we'll have to explain, that which this will be all right. And then the contrast sensitivity, which is low in the beginning, will come back to you, and then everything looks unfaded, and then your colors, everything will come back. And then, so when to expect complete correction, especially following surface ablation. It may not be complete in the beginning, but later on patients do not. And why post-op follow-up, just now I discussed. So all these things, again, we'll have to tell the patient, and then to talk about regression after surgery as to, well, see, many patients, they think that your number has gone completely and it will not come back. But there's something which is beyond our control, that is, say, regression, or under our overcorrection, which also we'll have to discuss later with the patient. What basically they want is, I mean, this is how I put it, say a person who is without glasses, he can't go to the market, he can't go out of the house and do something. Whereas now, that is not the problem, and whatever that comes, that remains, is very, very small. And then you tell your optometrist to make him read bilaterally open, so that they do not, otherwise they have that habit of closing one eye and seeing with the other, and so these things. So like this, communication is one thing which definitely reduces a lot of problems post-surgery. And the patient has got every right to know or to get rid of the doubts before surgery. Thank you very much for your patient listening.